So just one welcome again. And to the launch of the Antimicrobial Stewardship game, please remain on mute and please type into the chat if you've got any questions during the presentations. We are recording the launch, and also please introduce yourselves in the chat. Where are you calling in from? What part of the world? We know that we definitely have registrations from more than 9 countries across the world. So it'll be great to see who's come from the furthest away. If you're on social media, on Twitter, please tweet using hashtag CwPAMS and hashtag AMS game. And if you tag TETH or CPA, we'll retweet you to amplify your tweets. It'll be great to have you with us today. So just before we go into further details, the background to the development of this game is that it is part of our CwPAMS program, and the CwPAMS is Commonwealth Partnerships for Antimicrobial Stewardship. It is aimed to leverage the expertise, particularly in pharmacy, of UK health institutions, volunteers and technical experts to strengthen the capacity of health workforce initially in 4 Commonwealth countries. So we started off with Ghana, Uganda, Tanzania, Zambia. This was the previous CwPAMS program through which this game was developed, but we had an extension period during which we developed the game. And the projects focus on antimicrobial stewardship, including surveillance, antimicrobial pharmacy expertise and capacity, and infection prevention and control. My name is Dr. Diana Shirodope. I'm the Global Antimicrobial Resistance Lead for CPA, Commonwealth Pharmacy Association. And we've very much developed this game and CwPAMS in collaboration with our colleagues at the Tropical Health Education Trust, TETH, and colleagues from TETH are also on the call. And in terms of the game, we worked with the focus games, but you'll find out a little bit more about that shortly. And then in terms of CwPAMS evaluations, so really important for us is to show that it was a health partnerships approach with 12 partnerships across those 4 countries. And we had an evaluation which highlighted that we scored very good using the OECD DAC evaluation criteria for relevance, effectiveness, impact, efficiency, and sustainability. And developing this game was very much part of our thinking around how do we continue to support antimicrobial stewardship in these countries and also further afield, and particularly thinking about sustainability. Some of the key achievements that we achieved, some of the key achievements so far from the CwPAMS, as I said, were the 12 partnerships, which involved 187 volunteers from the UK and 102 volunteers from the 4 LMIC countries. And together, they trained more than 3,000 healthcare workers across those 4 countries. We have, through the CwPAMS program, there were more than 12 point prevalence survey sites as a result of CwPAMS. So hopefully most of you on the call will know that point prevalence is a way of assessing antimicrobial stewardship use within institutions. And we have published more than 14 peer-reviewed publications already. The game is one of many tools that we've developed. One of the probably our most exciting tool, but we also have an app that we developed, so an antimicrobial prescribing app. We've got a leadership development course that we've scoped for, PPS training, CPD platform for particularly for pharmacists, and also we developed a fellowship program. Apologies. We developed a fellowship program for global in global health for pharmacists for the first time, and we now have 16 pharmacists who have been assigned global health fellows status. We also have a stewardship toolkit that's been developed and a range of webinars and blogs. All of these are available through our websites, and so one of my colleagues will share the link to the resources shortly so that you can have access to that. We're now going to talk about the game in particular and launching the game, which we developed in collaboration with Focus Games. And I'm going to invite my colleague Sarah to be able to do this for us.
Thank you, Diane. Can you hear me okay? I'm going to tell you a little bit about how this game was developed. And it's a resource and a legacy of the CwPAMS program, which we are so proud of and very excited and enthusiastic about. So it's a real privilege to be able to share this with you. It's an educational board game for healthcare professionals in a nutshell, and it is available as a face-to-face game and as an online digital game, which we'll be playing in a bit. Next slide, please. Thank you. So before I show you the physical game, just a little bit of background. Educational board games have been used in health professional training for some time, really, but not everybody may be familiar with them. I wasn't familiar with them myself until I actually worked with a health partnership in sub-Saharan Africa about 5 years ago. But I thought then how engaging they were, and how actually it was a different way of learning that made it really fun, and it didn't feel like you were being tested. So after playing a different game, actually, a drug calculations game and a sepsis game, we then brought that back to our UK hospital and found it worked much better than some of the didactic teaching we had been using to date. So it's hugely exciting that we've been able, through the CwPAMS programme, to develop this antimicrobial stewardship game. It's used to build capacity. As I mentioned, it's been funded through the CwPAMS programme, which is Department of Health and Social Care Fleming Fund money. And not only has the game been developed in collaboration with a whole host of people, but we've also been able to ensure that 200 games are going to be shipped out to the countries that we are working with. The game was originally, the concept was originally to train health workers in low and middle income countries, but actually as we went through the process of developing it, it became completely clear that it is suitable and useful in any health and care social setting anywhere, whether it's a high income country or a low income country, whether it's in the UK or anywhere. So it's just a really useful resource, I think, and also it's portable. So we're going to be playing the digital game in a bit, but I'll just show you the physical game. Can you still see my screen? I think I just might have it in the wrong setting. I'll just assume you can. So
yes, we can.
Okay, that's fine. So this is what the box looks like. It's good and sturdy, which means you can take it to wherever you want to do your training, whether that's in the classroom or anywhere. You could even share it around different facilities that are in your area if you want. So within the box, there's a board. Those of you who may be familiar with the game Snakes and Ladders, it's loosely based on that. And you know, you will see how the game works when we play it, but the board again is good and transportable. It comes with really clear rules. We've also got the cards, and you'll see when we play the digital version in a moment, there are question cards and case study cards, and there are loads of cards, so you can actually pick the cards that you want according to your audience. So if you've got a whole room full of absolute AMS experts, then you may wish to leave out some of the more basic questions. But if you're actually wanting to include people who have less knowledge or experience, you can tailor it, and you can play it more than once because there are so many questions. And what we found, I think, as well, is playing the games across the disciplines works really well. Learning with other health professionals is a really good way of stimulating discussions and learning from each other. So what else do I need to show you? There's a QR code for feedback. It comes with a timer and a dice and little counters. And I really think this would be another useful resource to have in your training armory when you're trying to teach all the people you work with about what is a huge problem, and we're all part of the solution. So the next slide, please. I can't see that, but
yeah, I think we've just lost connection. We are just trying to get it back. Give me one.
Oh, that's fine. I'll just keep talking. That's fine. To ensure that this product, this game, this resource is going to be sustainable going forwards, and we can continue to maintain it, we will be, in addition to the 200 games that are being donated, it will be being sold with the policy of buy one and donate one. So for every game purchase, one will be donated to one of the currently 24 low and middle income countries that the Fleming Fund work in. And I think probably the more people that play the game and the more we can sort of share how useful it is. It will hopefully snowball. So if we go on, yeah, that's fine. So I was going to say, if we go on to the final slide, it will be available, the physical game will be available later this year, but as you know, the digital game is available now. And next slide, please. And then just to acknowledge the project team who worked together to sort of start the ball rolling. And next slide, please. But the people who really have made it as good as it is are the people who've contributed to the questions, who've from all the countries that the Fleming Fund will be working with this programme, who've just helped us every step of the way to make sure that the questions are relatable for all these different settings and in the UK. So we're incredibly grateful. And any feedback, anything you spot, just let us know. We'll be able to sort of respond to feedback as we go forwards. But it's just such an exciting development, and it's really, I'm just thrilled to be able to show this to you, and I'm really looking forward to playing the digital game. Next slide, please. And I think I'm handing over to someone else, possibly Diane or Richard. Thank you.
Thank you. If Melvin from, yeah, there you go, Melvin, if you talk us through this, thank you.
Hi, Melvin Bell. So we're going to move into the playing of the game. So just a couple of things just to let you know what's going to happen. So these are team games, and they're facilitated by a host. So we're going to break you up into breakout rooms. Each breakout room will have a host who will run and manage the game play for you. You'll play in teams, and we'll allocate the teams once you get into your breakout room. So we're anticipating that we'll play for roughly about 20 minutes. We're aiming to be back here at 1:45 BST into the main forum. So depending on individual games, will go at different paces depending on how people interact with it and how the conversation goes. But hopefully some will get through to the whole end of the game. If you don't, it's the team with the most points at the point when we say time up that will win. And the facilitators in each of the rooms will provide a little bit of guidance in terms of how the game's going to play, and they'll guide you through it over the next 20 or so minutes.
So hopefully you all enjoyed that session. Just wanted to give a quick feedback that we got from our team. Ignore our scores, but we all scored the same thing. So one of the points that was highlighted for us is that, just in case you didn't know, or others may have picked this up, is that in the Snakes and Ladders, you go up with positive actions that support stewardship and tackling AMR, and then obviously the snake, in this case going back down, is actions that do not support stewardship. So one of our colleagues in the call highlighted that it would have been good to just talk about that. So we believe that most of you on the call will be future facilitators. So that's just something to consider in that, to just remind. So for us, the purple team went up with immunization when they landed on an immunization square. How did it go in the other teams? Any other feedback?
So the May to whatever team, which I was in, apart from the slight headset technical issue, went very well after Nikki joined us. We wanted longer. It was very interesting, actually. Good feedback. I think I needed to mention that if you want longer than the timer, the facilitator can just gauge the group. So I think it's just to give it a bit of excitement, but you don't have to suddenly stop discussions if they're only just starting to get there, because actually the discussions, particularly across disciplines, is how everybody's learning. And even in this really small little play in our group, where we had lots of real experts and perhaps some people with less expertise, it was just really interesting discussions.
Yeah, no, it's really good. We didn't stop. For our session, we went past the timer all the time, every single time. I just kind of waited, and when they were ready, gave the answer. Yeah, please feel free to type into the chat your feedback on what you thought about the game in general from your session, and from a facilitator point of view. This is the first time we were facilitating this live. so we were learning as well as we went along, but hopefully it went smoothly. And also you picked some tips up from when you are facilitating the games as well for yourself. Just wanted to hear from the group, the pharmacy group. Fran, how did it go having so many pharmacists on the call? I guess they did as a learn and lunch session.
We had some really good competition, and unfortunately we just won. The team was just right at the last square, so we didn't actually get over the finish line. But yes, and it was great to see people judging each other's answers and, you know, helping each other out. But it was a very competitive group.
Very that's great. Ours was very collaborative. But I suspect it's because they know each other and they probably come as teams. Okay, thank you for the feedback that you're putting into the chat too. Please feel free to do that. And if colleagues, if we can just copy and paste those, because I think they're really useful quotes that we can use in the future. Okay, so Sarah, back to you. We've just got a couple more things. We really would love, we will close this at 2 o'clock, but we really would love your feedback. So we're going to give you about 3 minutes, please, to just quickly answer some questions from the feedback. It does come with a promise of a certificate and also a discount code. For those who are not part of the CwPAMS program. So if we can just also, we need to just put that link into the chat as well. I can do that, Sarah. So yeah, please, we'll just give you about, 2 to 3 minutes now. That's all it will take for you to just quickly provide us with feedback. And then we'll talk you through a couple more slides and some bits of information. And then you can go. If you're tweeting, please don't forget to add in the hashtag CwPAMS and hashtag AMS game. Or Melvin, if you've got the link as well, please feel free to put it into the chat.
We do just have a couple of wrap-up slides after.
Yes, we do.
Yeah.
I'm just seeing if colleagues have had time to thank you. If you've had a chance to just get started, let us know. And as we said, the certificate will come round, will be sent round within the next week, just to say thank you for participating and some CPD. We don't have CPD points though. So if you've got questions, do ask as well. So can you set for smaller numbers of players? Yes, you can. So you can have, so Mel, in our team, we could have had 2 teams or 3 teams or 4 teams, and then you can have 2 or 3 people per team. We don't need the email. We need your email as part of the feedback, please. That's how we're collating it. On the feedback form, there's an opportunity to provide your email on there. I can't see any other questions for now. So whilst you're completing the feedback, we'll just give, Sarah, you can move on to the next slide and, oh, hang on 1 second. Labeling as game false file of work web filters. Oh, interesting. Okay, so you mean on the website name, Mohammed, is that what you mean?
I think, I can maybe answer that. I think that some organizations will have blocks on certain types of websites, so that might be that. And normally what we find is if you let your IT department know what it is and show them it, then they will add it to the whitelist.
Okay.
Yeah, if that question came from somebody in the NHS, we have had that with some.
Okay, no, thank you for that. So what we need to do then is encourage facilitators to get it whitelisted through their IT team before they use it. Yes, Liz, totally agree in terms of healthcare undergrads. We'll work out how we can support them with that. Okay, Sarah, back to you.
So it's really just to tell you about an opportunity that is open now. It's an open grant call for an extended part of the Commonwealth Pharmacy for Antimicrobial Stewardship. Is that what CwPAMS stands for? That's awful, sorry.
Partnerships.
Partnerships, yes, that's the word, for Antimicrobial Stewardship Programme. So some of you will be aware of it already. We've already funded a number of health partnerships in the first 4 countries that we worked with. It's now open to a further 4 countries. So the 8 countries that this is applicable to is Ghana, Kenya, Malawi, Nigeria, Sierra Leone, Tanzania, Uganda, and Zambia. We have had queries about other countries, and unfortunately at the moment for this call that it will be limited to those 8 countries, but we do hope going forwards there will be other opportunities for, you know, to have funding and partnerships in other countries as well. So the funding available is £10,000 to £20,000 for each partnership, and that's whether you're a new partnership or an existing partnership. Projects are 6 to 7 months long, starting in October this year. The deadline is the 2nd of September, so you've got 2 and a bit weeks, 3 weeks to apply. And the central focus is on antimicrobial stewardship and developing pharmacy expertise and capacity. I think the link is in the chat to the information and the application. Everything you need is online. There was also a webinar held on the 30th of July, which if you hadn't attended, I think, can we put the link to that in the chat as well, if we haven't already, which was very informative. It talks you through a lot of the process, a lot of the rationale behind it. There was a lot of frequently asked questions, you know, and the website is very comprehensive. So you do need a UK partner as a healthcare provider to partner with you from the low middle income country on the application. Is there anything else that anybody else would like to add, Diane?
No, that's fine. Thank you so much, Sarah. So yeah, we hope that if you think you might be applying, please let us know in the chat. It'll be great to see which applications we might be expecting. It'll be we would love to have applications from those of you on the call, or if you know of any mixed partnerships already, you can encourage them to consider applying, particularly if they've not focused on AMR before. Even if they have, this is really an opportunity for us to extend our global health activities within the UK. Next slide, I think, will be
just the last point on that, that I know we were going to mention, was that if you have existing partnerships with UK institutions that aren't on AMR, then please explore with them opportunities that might be there, you know, to work with different people perhaps in the same institutions around antimicrobial resistance and stewardship. You know, utilize the contacts you already have to form these partnerships. I think that's Melvin.
It is. Thank you. So just in the wrap up at the next stage and the cost, hopefully it sounds like you enjoyed playing the game. So thanks for all that feedback. That's fantastic. The game will be available, as we said about sustainability. What I want to do is make this available to as many people as possible, and also to maintain it going forward so that we keep it up to date and keep it relevant. So you can, the online game is available for purchase at the end of today. And that will be £45 plus VAT for a 12-month subscription. And that's for the whole organisation. That's for access to your whole organisation. If you've done, hopefully you have done, the feedback form, at the end of the feedback form, you'll find there's a discount code in there as well, which will get you 20% discount on that. And we're also offering for this sustainability, this buy and donate. So for everyone that is bought, then we will donate access to one organisation within one of the target countries, as Dan mentioned earlier on. The physical game, the traditional board game, that will be available from the end of Q3. And as Dan said earlier on, there will be copies of that going free as part of the project to certain organisations and countries. So that will be organised a little bit later on. And if you, when it is on sale, again, that's available and it's £60 plus VAT. And again, the discount code applies to that as well. And again, for that, everyone that's bought, then we will donate one to one of the target organisations within one of the target countries. And if you go to www.amsgame.com, everything is there and all the links are from there, and we'll keep that up to date with new information and new activities as the project rolls on.
Thank you very much, Melvin. We've got 2 minutes left. If anyone's got any questions, please put it into the chat and we can try and address them now. I'm really grateful to have more than 80 people join us over the course of the hour as we launched the game. There's so many different aspects of CwPAMS that get me excited, and this is one of them. But there's so many things. But we really see this as a way of sustainability, a way of a legacy, and also not just for the countries that we're supporting, but available throughout the world and can be used globally. And hopefully those of the colleagues from the UK can see that the questions are directly relevant within the UK as they are in any of the African countries that we're working with, but actually can be used throughout the world as well, because antimicrobial resistance is a global issue and a global challenge that we all need to work on. So we hope, will you let us know when they are? Yes, so we will do some comms once the board game is available, and also to say we'll have another live game during World Antimicrobial Awareness Week. And again, if you want to use this during World Antimicrobial Awareness Week during your for part of your World Antimicrobial Week activities, please feel free to do that. But we'll host another global event. Just leaves me to thank my amazing colleagues from TETH, CPA, and Focus Games. It's been great to do this together. Vicky, our Executive Director for CPA, is on the call, I think. Don't know if you wanted to say anything, or Richard from TETH.
Yeah, thanks, Diane. Really great to see the board game being used, and thank you. It's been a really helpful demonstration. I know there's been so much work put into this over the last few months, so just a big thank you to the team really, and to Melvin and Focus Games for everything that you guys have done. It's really exciting, and I hope that we'll be doing many more kind of online sort of tournaments and versions of this in the future. I think we're already planning for World Antimicrobial Awareness Week. So yeah, thank you very much. And thanks, Diane, for hosting.
And thanks also from Thet to CPA, Melvin, and everyone on this call, and everyone who contributes to the game. It's really fantastic. It's the first time Thet has entered into the world of gaming. So long may that continue. Thanks, everyone.
Brilliant. Thanks, Richard.
No problem. Again, so hope to see you all soon. We'll look forward to your tweets, and have a good afternoon and weekend when it comes around, everybody.